Hey everyone, it's been a week, and so now it's time for another data update. It's been technically 6 days, but I wanted to go ahead and get these data out to you because some of the new data, usually I like to wait for the weekend, but then it's the weekend and nobody wants to think about science on the weekend. So I wanted to get this out today because there are some good trends that even if the data blips up or down today, these trends will still hold. And so there's things I want to tell you about. My biggest thing is that there was something I was hoping people would follow up on, and people have followed up on it, and the answer is good news. The answer is it tells us that a certain activity is safe, even though it breaks the 6-foot rule. Now, what I mean by safe and what I mean by how to do this activity safely, I'm going to mention that in a second. And that's why I call this how to break the 6-foot rule. But I'm also going to follow up on the other data, and I'm going to show you about the outbreaks that are going on right now. Why I don't think it's worth calling it a second wave. It's not a second wave. That's part two. So part one, the 6-foot rule. You all know it. We've come through the first wave of this virus, and we're definitely past the peak, at least when you add up everything nationwide. Before it even hit, we were told we need to stay 6 feet away from each other. And now that we have guidelines, this advice is being repeated. So I want to say, how important is this advice? We should test these rules, especially if they're the rules that we made before we collected more data on how this virus actually works. How important is the 6 feet rule? And it's a law of some sorts. It's definitely falls under the category of rules, regulations, taboos. How important is it? And I want to say that from my tradition of Christianity, I am reminded of a certain letter from Paul wrote to the Galatians, and he referred to the law, the Torah, as the guardian, the tutor of us all, until we come to the cross in St. Paul's words. So, not to get too theological about it, but I do want to say that St. Paul talks about the role of the law. It's a good role, but it's a limited role, and it's to act as our tutor until we're able to move past the particular rules. St. Paul is talking about very different rules, but I think it applies in a certain vague sense to this rule as well. The 6-foot rule, how important is it? And so the thing is, the 6-foot rule, how do you apply it? Once you get down to the actual things, it wouldn't make a very good law because there are certain situations where you have to bend it. My best example is when people take a picture of all these people in the park and they say, oh, these people are breaking the 6-foot rule. Well, the 6-foot rule doesn't apply if you're in the household of that person already. So if you're taking a picture of people in a household that are closer than 6 feet, then that's fine with the rule. So be very careful about imposing this rule on others. What I want to say is, how should we do it for ourselves? And you may have seen this. This is actually a very helpful starting point. This is where they crowdsourced 4 public health experts. If I remember correctly, they were all men, or maybe 3 or 4 of them were men. And they're all from Michigan. What I want to say is, this isn't a very big crowd to rate these activities in terms of risk. Nonetheless, 4 is better than 3, even if they have certain things. And so, of course, they're like PhDs, MDs, doctors, and of course they say that playing tennis and golfing are going to be low risk. I think they might have a bit of a bias towards saying that those activities are lower risk than they are. But let's look at the other end of the risk spectrum. All these risk things, it's nice to see these things that we all agree are lower risk than others. The one I want to focus on is getting a haircut. One thing that I sort of need right now, as you can probably tell by looking at my hair. But the thing about hair salons and barbershops, they're way down in the corner over there, and it says risk level 6. It's actually above average risk. This only runs from 1 to 9, and so we're at like the 2/3 level of risk. How risky is it? Well, we have a real-life situation where this was tested, and we can see what the risk was. In this one case, what we want to do is we want to question these calibrations, but this is probably okay as a general rule separating high risk from low risk. You don't want to say 5 versus 6, but you do want to say 8 versus 2 is probably a real difference in risk here. So how dangerous is it to get a haircut? We had a real life test, and a lot of people passed this around. May 24th was when this came out. 2 hairstylists at a Springfield, Missouri salon had COVID. One of them had it for like more than half a week. The other one ended up getting infected, presumably from the work contact with that other one over a course of days. And so the thing is, this is after reopening. Everyone was masked. What was the real risk? It could be transmitted from stylist to stylist over a number of days. Okay, that goes with the Korean office studies and things like that we've done before. But the real thing is, they followed up with all their clients. There are 140 people that got their hair cut at that salon. And there are also 6 other stylists who work with them. Did any of them ever show symptoms or show virus? This just came out. And this is June 8th, and this is the health department. And it's actually there's a lot of happy words in this. I actually recommend reading this because they say this is exciting news about the value of masking. They tested the 6 other stylists. They tested a large number of the 140 clients, and all the 140 clients were watched and followed up with to see if they developed disease. How many do you think developed it? The answer is 0. So we have 1 case of stylist to stylist transmission over days. For 140 people, we have no transmission, no evidence for transmission. I'm comfortable with saying from this sample size that there appears to be a less than 1% risk of infection if everyone follows the masking rules. And just to put that with my favorite numbers that I've come up with, and I've talked about these before, if the infection rate ratio, the infection fatality ratio, is 0.7%, if there's a 1% chance of infection, let's take the upper bound of what I think the reasonable interpretation of this might be. That times 0.7% means there's a 0.007% chance of death for getting a haircut. And again, this is probably an overestimate, and this is also for the average of all people, which would be 20-year-olds, 40-year-olds, 90-year-olds. Less than 7 out of 100,000 events would result in death for the average of all people. If you're 50 years or younger, remember that IFR goes down by a factor of 10, roughly. And so that works out to be less than 7 out of 1 million events for this risk level, which is one of the higher risk level items on this. So for this particular case, risk level 6, wearing a mask, I think 7 out of 1 million events is relatively low risk. It's the kind of thing where I will probably do it myself. Now realize this is not 0 risk, okay? And realize this is also infection fatality ratio. What about the people who develop chronic disease? Like I said, I know 2 people who have developed some sort of very troubling chronic disease. This does not account for all that, but also we've got to weigh all that for ourselves. If you're black, then the risk goes up by a factor of 2, roughly, and that's looking at a number of cases. So you've got to multiply this risk out for who you are and who the people that you're taking care of and in close contact with are. So don't take this as just being a 1 in a million. It's not a 1 in a million. It's a 7 in a million chance. But still, that's what we use 1 in a million for is a low risk event. So it seems like the risk for this is acceptable without other factors coming in. The other thing is, what about opening schools? They didn't have opening schools on that chart, by the way, which again shows a little bit of the bias of the people, because to me that's one of the most important questions. But also we don't know that much, so I'm not sure if I'd trust a crowdsourcing about schools. Instead of asking the experts, let's look at the countries. And I've done this before. I've shown the countries, and let's follow up on France. May 18th, France opened up their schools. Millions of students. Do they get millions of cases? They don't. They don't even have, for the past week, we have 2,000 confirmed cases across the country. And so you notice their line, it's even gone straight down, but then it's gone back up. There's a sharpness to the line that shows just that the data's messy. Something's going on, but it appears to be going on at a very low level. The other thing I'd like to point out with this is look at Denmark and South Korea. Denmark is actually below South Korea now. So before I was holding up South Korea as the example of what I hoped we would follow, and Seattle area has actually followed that example. But now Denmark's opened up schools in a way that South Korea has not been able to. So there's all sorts of things. We've got to keep an eye on the dynamic situation as it unfolds. Both Denmark and South Korea are doing okay. I just think it's kind of weird. I wonder if South Korea might have suppressed it too much for this particular kind of virus. IFR of 0.7, R0 of 3. Respiratory. And that's why wearing masks will help. So you can see right there that France is doing okay. It's about a month after we opened schools, and we don't see any nationwide expansion. There's a possibility that it will come back. All we can do is watch and wait and look at the actual data for real-life transmission now that we can have it, okay? So cases in King and Snohomish counties, you know I have to show this, they continue to drop. The blue line's King, the orange line's Snohomish, they're both going down. This is the whole course of the disease as long as it's been going on since early March. Okay, so let's zoom in on the past couple weeks since the 10th of May. And if you just fit it with a linear trend line, they're both definitely going down. Because King has 4 times greater population, they have 4 times greater of a line here. And you see that day by day, you see spikes going up and down. You have this 30th of May where you have a big spike up. Well, that comes from a reporting backlog, I'm guessing, that they put it all together and then they report all the tests on one day. If you average it out week by week, you get a much smoother curve. And so just remember, never look at the data day by day. Make yourself a promise and keep that promise that you won't be freaked out by 100 cases in a day. The other thing that we can talk about is in King County, there were massive thousands of people at protests. They were outside, many of them were masked, but they were close together and many of them were shouting. So put that all together to say physically, what is going on with the virus? That's what the virus will respond to, the physical contagion of it. And I couldn't find protests on the list either. Shows you that these lists are of limited value at some point, but they still have value because I found walking downtown. Walking downtown, not shouting. Okay, let's say that that's a 4. So we had a massive level 4 safety event that happened right about right there. And cases went down. Again, don't be distracted by that one spike that happened a few days later. That is clearly not what the data is saying overall. In fact, for the phase 2 threshold, which I've talked about before, Snohomish is definitely still within there. They've been able to move there. And look at this. For the past week, most days for the past week in King County have been well below the threshold. We have 4 days in the 20s, and then 2 days just above the threshold. That definitely averages out to be okay. The thing is, we supposedly need 14 days. Basically what we need is for these trends to continue until that 108 case day falls off, which will happen in 3 or 4 days. So in 3 to 4 days, I predict that King County will be within the phase 2 threshold. And so hopefully we can drop this really confusing what phase are we actually in kind of thought. And we can see it's been long enough that I should expect protests to bring up cases by now. Maybe it'll percolate and they'll spread around for another couple weeks, but this is looking good. Okay, it's looking like I don't see any uptick. Do we see an uptick in hospital admissions? And I'm happy to say, finally, we have a hospital only King County admission. It's slightly different from the Snohomish one because it is new admissions rather than currently hospitalized, but whatever, it's going down. Okay, so you see this, and you see that you have these hospitalizations. Recent dates may be complete. There's no evidence for any kind of uptick yet from the protests that happened. And there's a march going on today. So I say, yeah, there's things that are more important than the bodily risk of COVID infection for the average person. And so, if you want to protest, the science says that we don't see a bad effect from it yet. But do we see a bad effect from reopenings? You may have seen this. Second U.S. virus wave. Okay, I've already said beware of the word spike. And I'm going to start to have to say beware of the word wave. Because everyone is referring to this And they're kind of seeing a wave when there's no evidence for a wave. We are still in the first wave. It has a long tail, takes a long time to go down. From the noisiness of the data, people are pointing at these things and saying, I think that there is a second wave going on. And specifically, we see rises in cases in Texas, Arizona, Florida, and California. I talked about Florida last time, and I don't have good hospitalization data for Florida. I just have my friend there. So until my friend starts talking to me and saying, hey, it's really bad here, I'm going to say that Florida continues to be okay. California is a big state, and they've always had problems with data reporting. But Texas and Arizona, I actually mentioned those before, and so let's return to those, and let's see if there is a evidence for a second wave. And I appreciate, at least in the sub-headline, you get the experts say that the surges can't be linked directly to reopenings. At least you have that, but who reads that, right? You just click on through, right? So read the sub-headlines is what I'm saying. So, can you pin the tail on the donkey here? Can you pin the tail on the spike in the data? Here's the nationwide data, going back months. If there's a second wave, it should be something that you can see at this level. And there is clearly nothing that is more fluctuating than the normal levels of fluctuations down on the weekends, up in the middle of the week, that we usually see for case reporting. You see it is going up, and maybe there is a bump, but there's definitely not a spike, not nationwide. And this gets to all of us. This is one of my favorite science reporters, but I have to show this, so I want to say, listen to Helen Branswell. Follow her on Twitter. But whenever anyone, even Helen Branswell, says something like this, take it with a huge grain of salt. And she does that. She says Massachusetts COVID numbers increased by 519 in one day. It used to be less than 200. One day is one day, but still, ugh. You know, I agree, ugh. But I sort of reserve a little bit of my ugh for the breaking your own rule. Don't interpret one day of data. In fact, you can go to this site. And this site will give you the, this is the Tableau site. I have the address for it on another slide here. This site will give you the overall curve. Hospitalizations are way down. Deaths are down in Massachusetts. That's red all the way on the right. And the cases that Helen Branswell was talking about are on the yellow. You can actually see it if you squint really hard. You can see that there is an uptick of 500 cases, a little light gray bar, way over on the edge of the daily positive yellow graph. But you can see from this, yeah, there's been some sort of weird bump. Even that big bump that was up, that was caused by a day where they reported 4,100 cases. That clearly is not something that's reflected in the hospitalization data. That is a reporting glitch. And so if you look at the graph, that's why we look at graphs, because it means that we don't have to rely on one day of noisy data. Massachusetts is doing fine. In fact, the entire mid-Atlantic is doing fine. Here's from that Tableau site, and you can see the address up there. If you're worried about a state, don't share the story without looking at this site. This site will show you what we know. And it's adding up the currently hospitalized numbers for by region. Remember that some states don't get accurately scraped by this particular tool. But still, on a nationwide basis, this is going to be pretty accurate. You can see Mid-Atlantic is definitely way down. Midwest is going down. New England's going down. South, Southwest, and West are flat or maybe ticking up. And in fact, so that is something to keep an eye on. That is evidence of a local outbreak. But the outbreak remains localized. Here's Arizona again, and Arizona has stayed up. They're currently hospitalized. At least it's not going up. It's been like half a week where they've been on average around 1,300 hospitalized. Per capita, by the way, Arizona and Washington have about similar population sizes, and Washington's peak of hospitalization was 600, although that might have been cut off because it might have been higher before that. It wasn't reported until a certain point in April. But all that's to say, similar populations. Arizona now has twice as many currently hospitalized as Washington did. So it definitely looks like Arizona is hospitalizing a lot of people. Deaths have not really ticked up yet, but I'm sort of expecting them to. The one thing to notice is these are high levels. It's not that Arizona was up and came back down and now is going up again. It's sort of a slope, especially if you look at the daily positive, which is the most reliable results, and you compare that to daily testing. This is the beginning of an outbreak for Arizona. All this is to say, Arizona is in the middle of the outbreak. If there's any place that should shut down, practice distancing, wear masks, it's Arizona right now. But at the same time, this is not what New York City has seen yet. We're always worried, and we don't know for sure yet that Arizona can't turn into New York City. But we've only seen New York City once, and this is not at that level yet. This advises precaution, but it looks like this is just the wave, the sparks of this disease spreading out through the nation, and they landed on Arizona later than they landed on other places. Texas is a case where people have been keeping a close eye on it, and Texas hospitalizations are going up, as well as tests and positives. If you look at this, the positive rate and the testing rate are roughly correlated, the blue and the orange. And so that means that there's not a huge difference. It's not going up in positive rate, but it's not really going down either. The important thing to look at in that case is hospitalizations. And Texas was flat, and then they went up. The last day, it just ticked down. Maybe that will be the beginning of it ticking down again. But Texas is currently the home to a couple of outbreaks. Again, the local outbreaks may require a local response. But I'm seeing a lot of people who don't know anyone from Texas who's posting about how they're worried about Texas. And I want to say, yes, worry about Texas, pray for Texas, but you've got a lot of other things to worry about as well. And so social media can distort how events elsewhere in the nation affect you. We are all in this together, but you aren't going to help Texas by giving yourself an ulcer over the state of Texas. You'll help them by sending doctors and nurses there, by sending donations, by other things like that. In fact, why is Arizona, Texas, California, New Mexico, all of these states are seeing cases going up right now and hospitalizations going up? One of the things I've seen, I wonder if this is because they border Mexico. Mexico right now, you see, they're still going up on this graph. Remember, northeast is bad. The dotted line is about as bad as it gets for expansion. And so Mexico is actually still going up. I don't know how much traffic there is across the border. I know it's closed in some ways, but I've heard it's also open in other ways. And that means that you might have case migration from Mexico into these states. This is probably an echo, and I would like to see an analysis that actually looks at that. So, all you can say is Mexico is in the middle of an outbreak in a way that actually the U.S. as a nation is not anymore, but you have sort of a diffusion of the virus, and that could be what's going on. Basically, the main thing, remember that the nationwide data is a big curve of cases. A big bell-shaped curve with a long tail. It's made up of hundreds or even thousands of local outbreaks that the best way to look at those is probably county by county, if you can, or state by state is good in most cases, except for big states like California. It's hard to even look at those at that level. The main thing about this is I've talked again and again about how the R0 for this virus is around 3. That means it's very infectious. But we brought the R0 down by lockdown and social distancing. That means that you can affect your local R0. R0 is not hardwired into the virus. It is how the virus interacts with our social structure. So you can affect your social structure. You can decide which activities you do. And everyone's going to be taking a certain amount of risk. And by the way, some people can't even wear masks. So don't judge someone else's risk or how they're doing. Yes, their risk can affect yours, but we can't know everything about their factors that go into them not wearing a mask. That said, wearing a mask is about the simplest way to really bring that R naught down. And it looks to me like it actually might be enough to allow you to get a haircut with only a 7 in a million chance of something really bad happening if you're a certain age range and risk category. You can affect how the virus gets to you. And so for a respiratory virus, a lot of people have said, I don't think the mask does much good. Well, I do. And I've seen how this virus spreads, and there are many other cases of real-life transmission. Now we're getting to real-life transmission with masks, and I'm predicting that the masks will have a big effect. The hair salon is my first example of that. I would like to see more examples. By the way, let me know if you see an example that contradicts what I have to say here. The hair salon is just one example, but it's one case where we actually followed up with people, and we know whether people were masked. We know a lot about it. Seems a small price to pay for being able to do some of these things that we haven't been able to do for months now. And the thing is, months is a long time to do social distancing. We need to find some ways to relax. I think one of the ways we can relax is by wearing masks. So with all that, my advice about wearing masks. Let's go for another week, and let's hope these numbers continue to go down locally, and let's hope they start to go down in those southwestern states where we're seeing the outbreaks right now.